Every week, Surfing the MASH Tsunami brings you three major stories from the world of steatotic liver disease. This weekend, we're bringing you each of these stories separately so you can listen over a shorter, discrete period of time. Hope you enjoy them.
For the last 5 years, MASLD stakeholders, whether manufacturers, trial sites, providers, payers, patients, or investors, have turned to Surfing the MASH Tsunami to keep track of drug and device development, epidemiology, public health initiatives, and practice patterns. This weekend, we are sharing the three main sections from our episode 7. Roger will provide more information after these notes from our sponsors.
Surfing the MASH Tsunami is sponsored by these healthcare-related organizations: Liver Right and the Liver Right Scanning Network. On April 15th, 2025, Liver Right will open America's first virtual specialty clinic for liver disease, offering adults in all 50 states video appointments and helping GI practices and health systems triage and treat the swelling numbers of patients seeking MASLD and MASH testing. Liver Right offers same-week video visits and accepts insurance. For more information, contact Liver Right, that's liver, and then RIGHT at www.liverright.com.
Tawazin Health, your partner in global liver health innovation. At Tawazin Health, we specialize in providing small or large-scale access to FibroScan examinations for liver health-focused early detection, clinical trials, independent research, and collaborative projects with clinicians and FibroScan providers increasingly throughout the world. As industry-leading experts, we design and deliver high-quality FibroScan services because we know that accurate, high-quality, reliable data drives better outcomes. To learn about our sister lifestyle app, mylife365.me, click the Tawazin Health link on the Surfing MASH homepage. And now Joseph Willemse joins Roger for this week's Newsmaker segment.
This week's Newsmaker segment is with Joseph Willemse, president of the Dutch Liver Patients Association, one of the co-authors of the recent People First Charter on treating SLD, and a long-recognized leading global advocate for liver patients. Jose and I discussed two items. First, the exceptionally successful patient screening activity at the recent EASL Congress in Amsterdam, and second, the concept of patient-sensitive communication so that we avoid unnecessary patient stigma while providing the knowledge patients need to make intelligent decisions about and manage their own care. This week, our Newsmaker interview is with Jose Willemse, currently head of the Dutch Patient Association, although you've already retired from that position once and are seeking to do so again, and just a tremendous supporter of EASL and a whole bunch of other activities around liver disease around the world. Jose, how are you doing today?
I'm very fine. Thanks a lot.
And thanks for taking the time to be able to talk with us. As I think I mentioned to you, we're going to try to talk about really two things today. First, Louise Campbell mentioned during the roundtable about the scanning activity in Amsterdam during EASL, and I know you were integrally involved with that. So I'd like to talk about how that came to be and how it went and how many people you scanned and what we learned. Okay, number one. And then number two is I know that you're also a co-author on the People First Charter for liver disease that was the focus of a lot of the discussion at the think tank in Barcelona. I know, unfortunately, we weren't able to make it to that meeting, but I'd like to talk about how you feel about that charter and how you think that charter and the Amsterdam screening activity are connected. So let's start with the Amsterdam screening activity. How did that come to be, and what was your role in making it happen?
Yeah, that was amazing. We did that in Vienna during EASL and in Milan. And it was quite a success. We had 2 screening possibilities, and there were some queues, 10 people, something like that. And we didn't know how it will end up in Amsterdam, but we put a lot of effort in it. We put a lot of effort also in awareness of the liver with 2 Dutch doctors. And the city of Amsterdam, that's a huge organization. We organized school visits where we teach to the children about the liver and what is healthy for your liver. And we had a project that how healthy is your liver. And that was the possibility to have a free liver test. We don't talk about screening because that's a legal thing here in the Netherlands, but just how healthy is your liver. And we didn't know how many people will show up before, but a week in advance, I saw that there's a big Amsterdam newspaper and with, I think, 3 million readers. And they had an article. And I thought, oh, wow, this is really fantastic. Because if they have an article, we have also a local broadcast. Probably they will show up. And the first day, there was Dutch news broadcast, just the national ones. And there was already so many people that everybody was like, wow, wow, what's happening here? And then the first days, it was in every news program on the Dutch television. So it was not only an Amsterdam thing, but also a national thing. So the first in the first days, people from Amsterdam showed up. But at the end of the week, people showed up from the whole country. And every morning, when I arrived very early in the morning, there were already people. People started there to wait at 4:30 in the morning to have that test. And they waited for 4 hours. And know that we Dutch don't like to wait. We don't like queues. If we have to wait 5 minutes, we will leave. Like, oh, well, let it go. I will see, or I will go again. But they waited. And every morning I went to that queue and I said, hey, fantastic that you are. I introduced myself. And I said, why are you here so early in the morning? And they said, we are in shock. We never knew about the liver and how important the liver is and what the risk is when your liver is not healthy. And I was really happy with that, because if you ask the government to do, just made some awareness programs, they never are interested. No, it's not interesting, not important. And people were so in shock how important the liver and liver health is that they showed up and waited for 4 hours to have that liver test, the FibroScan. The problem for the EASL side was that we needed more FibroScans, and just extra doctors and students were trained rapidly. And everybody, also a person like Louise, were asked, can you just join a few hours, because we needed staff. So, and the second day, because it was already on the news that it was so very busy, people brought chairs with them. Every day people told me, I'm so in shock that I didn't know how important the liver is, and that if your liver is not healthy, that you can do by yourself things like a healthier lifestyle. And they asked me, and what is a healthy lifestyle? So I talked a little bit about that with them at the chat. But people were so motivated to have that FibroScan. But there were people that showed up 3 times and they said, I still don't have the scan because it's too busy. There was, I think in the middle of the week, it was even, because it's the convention center is close to the highway, that even the exit was blocked because the cars couldn't through, because the line was too long. It was amazing. And every day there was Dutch television, and it was in every newspaper, local newspapers, not only Amsterdam, but in the whole country, and that people traveled. I spoke to a guy, he came from the north of the country, and he left his home at 1:30 at night to be there at 5 o'clock, and he wasn't even number 1. And so it was amazing. And we are wondering, well, how did that happen? And I think we were very lucky that City Amsterdam and the RAI Convention Center, the RAI is the name of the convention center, put a lot of effort in it, a lot of publication, and they guided us really very well. And that was very important. And then at that time, there was no other news, because it was in the time that they had to vote for a new pope, and that was still not happening at the end of the week. So that helped maybe a lot. And the weather was nice. It was not raining. It was beautiful weather. It was even very hot for that time of the year.
How many people overall were screened through the process?
Well, I heard from EASL that, because I don't know the real numbers, but I think they screened about over 800 people.
Wow.
But the first day at night, the first GPs sent already their patients in for an extra check. Because you could have, I think it was 4 messages, like your liver is healthy and keep it healthy, and you do this, and here are some advices. Your liver is not so healthy, you have fat in your liver, but it's reversible, but here you have some advice. And then, or you have really fat in your liver, and it's not too bad now, but go to your GP and ask for another test, and the people get a letter for their GP with an explanation. And if it was really, really bad, I thought that the doctors phoned the GP for the patient to explain what's going on, and that there is really a need to refer them to a hospital. But the first day, the first appointments were already made in the hospitals. in Amsterdam. So it worked.
You say appointments were made in the hospitals. Of the people who came through, do you have any sense of how many or what percentage wound up needing to be referred?
No, I think we have to wait for that, for EASL, because they're still working on that. So I don't know, but probably they publish it for sure. And I know from the Amsterdam doctors, there's one Amsterdam doctor, and he said he saw about 50 patients in a couple of weeks, and at least 5 were really severe.
I was talking with either Naeem Al-Khoury or Mike Patel recently about a screening thing that they did together in Cleveland, and the people came out of that with F3 and even some with cirrhosis. Did people say anything to you? I mean, you made the point that folks talked about how they didn't realize this was so serious. Were there other comments that really spoke to you that people made about while they're online?
They were happy that the opportunity was there. And well, it's for free, but that helps also. I think in a lot of countries that helped. But the most given comment was, I didn't know that the liver was so important. There was one guy who said, I didn't even know that I had a liver. Well, people said, I know I have a liver. And we have a lot of migrants, and they know what a liver is because they eat that a lot. But I never realized that my liver is probably not healthy. And I explained to them that one of the problems is that your liver can be very unhealthy and you don't feel it. You don't feel sick. But it can really be worse, a worse situation for your liver, and you still don't feel it. And I said, and that's why we need just more knowledge also in the audience. Like from, well, how important is your liver and how do you take care of your liver health? Because you don't feel it. You can be very ill, and if you feel very ill, then it's too late. So people were shocked that they said, there was a guy who said, well, I think I'm healthy. And I said, yeah, but you never know. And then later he came to me, he spotted me again, and he said, I have a bad message. And I said, and that is, he said, I have a letter from my GP because I have a lot of fat in my liver and I wasn't aware of it. And I thought I was living healthy. So and now in the Netherlands, there are some actions in Amsterdam as well, because the city is very keen on, well, how do we get the people in Amsterdam healthy as possible? And the Dutch Dr. Bart Takkenberg, he is really one of the leads in this whole project, and especially in school projects. How can we move on? How can we just keep the attention to the people without they just say well, you have to live healthy. Everybody knows that you have to live healthy. But the problem is, what is healthy? What is liver health? But the fact that people didn't know that how important your liver is and what a problem it can be if your liver is not healthy, that it's really can cause a lot of liver diseases and other diseases. They didn't know. They know about diabetes, cardio part of the diseases, but they never realized that the liver is even a bigger problem in the health than the diabetes and the cardiovascular part.
That's fascinating, and I think a little surprising. Maybe not a lot surprising, but certainly a little surprising. So you mentioned, now, there are two ways of thinking about 800 people, right? One way is to say, wow, that's a lot of people to wait all those hours. The other way would be to say, well, this is a large metropolitan area. You said over 3 million people, and only 800 showed up.
No, they showed more up, but that was the maximum capacity they could do.
Okay, so did it actually turn people away?
Every day. Over 1,000 people showed up. And of course, if you look at the amount of people in the Netherlands, we have 18 million people, and we have around 750,000 in Amsterdam, of course. But I know a lot of people who cycled to the right and they saw the queue, and I thought, well, I never make a chance today. I'll try tomorrow. And the same thing happened. What I think that the lesson learned is that people do want to know. You can't ignore it, how important it is. How in shock they were that they didn't know how important the liver is. So the liver is important, and there is a big need just to educate people about the liver. And that's what we do with the school projects. That was very successful. And we started, I think, because the City of Amsterdam helped us with that too. I think we started with 4 schools, and then we ended up with 12 schools who were interested. So we really have to think about, so what's the next step now? Because we can't let it go. And I already told people in Barcelona, so that's, well, I will talk to them because you need a lot of preparation for this. Because if the Dutch press didn't pick it up, people will show up, yes, but that will be the people from our inner circle or maybe a small announcement somewhere. That was also the help of the city of Amsterdam and the Rij Convention Center. You need that too, and a little bit of luck. But that people, Dutch people who are impatient, as you can imagine, queued for 4 hours, brought their water, brought some food even, and their chairs, and sold their chairs. There was a guy, I bought it for €2 because the guy didn't need it anymore. And so that's really amazing. And so you can make a lot of jokes about it, what happened in those queues. But it was so overwhelming that the Rij even had to hire more security to keep the people in line. And that they say, well, I'm sorry, but this is the last person we can test today. And people didn't accept it. They just stayed in line, hoping that somebody will just remove themselves from the line. And that tells a lot about the need. So that's what amazed me still, that my Dutch people who are impatient, as you can imagine, wait for 4 hours because they want to know how healthy their liver was. And that's
interesting.
Yeah, that's very interesting.
So you mentioned Barcelona. I assume that's because that's where EASL is next year.
Yeah.
Right. Do you think that there's a future or a way to run a program like this again in Amsterdam, even though EASL isn't there anymore?
Oh, yes, we will go on with that, with the city of Amsterdam for sure, yeah.
Okay, and when do you think you'll be doing that again, and how often, and in how many locations and all that?
If EASL is back in Amsterdam, we will probably do it again. But we have to think about that, because we have to deal, and that is something that, to be honest, the GPs were not so happy with it. When patients showed up and like, oh, well, I was with the Rij, the FibroScan, or I was in line, so can you offer me a FibroScan, things like that. So we had, that maybe we had done that better, but the other way, how many years are we, also the patient organizations and the hepatologists, telling the GPs just test the people who are on high risk, do an ALET or an LT, and just look at it and keep an eye on those people who are on risk. And then a lot of them never did. And that is something that we have to talk also about, how do we deal with that? Because, to be honest, if those people were at the GP, because you could see from just a distance who was on high risk, because they were very obese, and people told me, I have high blood pressure and diabetes, and nobody told them about the liver risk. And that is something that's a doctor thing. That is something for the medical part, for the doctors who take care of. But we don't want to judge or whatever, but that we need a plan how we can scan those people earlier, how can we just have an eye on them, like, hey, maybe you are at risk. It's not necessary for a GP to look at this whole population and say, oh, well, let's ask to come them to practice. No, but if you see them and keep an eye on them, like, hey, wait, you tick all the boxes, let's do an extra blood test with the ALT, then we know more. Things like that. And so it's just a matter of behavior, because you don't want to give the GPs a lot of extra work, because we know all doctors are extremely busy, but from the GPs all around the world, they are extremely busy. But it's all about the patients. And to be honest, from a patient perspective, I'm sorry for the doctor that he is already so busy, but it's about the health of his patient or her patient.
Point well made. And I think one of the problems we're going to find all over the world, and we'll be talking about this on the podcast this year, is that there isn't really capacity to treat anywhere in the system, right? Not a lot of hepatologists. It's not how gastroenterologists are most profitable or like spending their time. Primary care has more to do than they have time to do it. And we don't have enough APPs trained up, and it's going to be a challenge to figure out how the system is going to expand as the number of patients expands. And what you're talking about right now is kind of a cardinal example of that. Folks folks waiting after they were told they couldn't get in to see their doctor because they were scared for their liver and they didn't have any other way to deal with it.
No, but and there's one thing that I think that next time we can involve the patient organization more in that, because we have a great brochure in Dutch about just the low-hanging fruit. What is it? What is wise to do? And if you have to exercise, do something that you liked when you were young, that just picked up. And you don't have to go to the Olympics if you start to play tennis or whatever you want to do. Yeah, so we can play a bigger role, and we were thinking in the association, we are thinking about it because we are a patient organization. In a patient organization, your members are already ill. In the Netherlands, we have all liver diseases, so we have to find a balance between just the prevention part and to take care for the people who have already a severe liver disease. But there are a lot of challenges. We can just try to look at what can we do, and if we have on a regular basis just some campaigns like we had with the RAI, that will be fantastic. And this was really an opportunity that we took with both hands, and it worked out very well.
Great. One more question about this, and then I want to shift and talk a little bit about the People First Charter and how the way that we talk about liver disease has to do with making things like this work better. Have any of the other cities in the Netherlands, Rotterdam, Hague, Den Haag, whoever, looked to repeat or emulate this program, or is it only an Amsterdam program?
No, it wasn't only in Amsterdam. We talked about that because with the school project, The Hague and Rotterdam were also involved. And in Rotterdam there was the project, but it was also a matter of possibilities in the organization and just to have the possibilities to do that because EASL was there, so we had some fiber scans for free and things like that. So that's something, maybe a next step that we can talk about. But I know that like the Erasmus University Hospital, they have some programs in parts of Rotterdam to scan people and to work together with the GPs. How can we find those people? How can we monitor them just together with the GP? So there are already some programs running. There is a care path in Amsterdam running. So there are things going on, but and now the people have in Amsterdam to do the FibroScan for free, and that makes why they showed up.
Yeah. So with that, let's shift a little bit. I know you are one of co-authors on the People First Charter, which really talks about how do we discuss liver disease with people to get them to do the right thing, decrease stigma and increase productive behavior. First of all, what do you consider the most important parts of getting that right?
Well, it's an extremely important document. Language matters in the relationship between the doctor and the patient. In general, it's not only about MASLD or the liver. With the liver, we have the big stigma people have to deal with. And it's so easy to change the language to patients to feel they're comfortable. And what a lot of patients say that I am more than my liver. When I go to my doctor, it's all about my liver. It's not about me. And you see a change now, but you can also see that language matters. If you look at the document, that we have approximately 70 expressions that you could do different to make it to feel people more comfortable. You are not a sick liver. You are a patient with a sick liver. And I was so amazed. And for me was the most fantastic part was also to see how involved the doctors were and how they come up with so many examples about say that different. And I wrote also an article for Dutch hepatologists about the 10 most stupid questions you can ask your patient. Mm-hmm. And then I gave them some advice to do it better.
Okay.
I talked about with an American doctor as well, and he starts to laugh. He said, "Oh, you're so horrible, right?" Because if you are obese, and people know that they are obese, and probably they are obese for years, and then you come to a doctor, and the doctor said, "Yes, but you are obese." I was obese myself, and I went to one young doctor. I said, "Really? No, why did nobody told me that?" And he was really shocked. I said, yeah, but you have to lose weight. And then people go home because that's the message. And then they phone the patient organization, but how when I live healthy? And yeah, sure, but there are some pitfalls. And then we talk about it. But the best the remark that was made that I heard was, listen, tell me what kind of diets did you already try? We don't have to talk about it anymore because that didn't work. So we can skip that part. So it's all about trust. But keep in mind that patients are very good in self-stigma, because if I make the remark or the joke, you don't have to do it anymore. Sometimes it really hurts me to hear how people talk about themselves with a lot of stigma. And I thought, why are you doing that? It's really not necessary. You are a human, and yes, you have a problem, but we have to look how we can work on that. And it's not your fault because, it's my own fault. No, it's not your own fault. It happened to you and things like that. And this document was I'm so very, very proud. And I'm so proud about how many people worked with that and with a great enthusiasm. And that's that's really wrong to say and things like that. Yeah, so it's so important that language matters. It really matters. And this is something new. And doctors, they're doing this with the best will in the world. Their intention is extremely well, but they don't have a clue what the effect is on the patient who is going home so frustrated. You know that they are obese. And if the doctor talk about, yes, but you are obese, yes, they know. But it hurts. It hurts so much. But the doctor don't know how much it hurts. So, this document is really fantastic. And it was created from the group who is very active in MASLD. It's a fantastic expert group. And with Jeff Lazarus in the lead. But I think we can copy-paste this for a lot of diseases. You just can...
Okay. So, we're blessed with a really wide set of listeners, ranging from people who are aware of all these issues to those who aren't. So I'm wondering if there are just 2 or 3 simple rules or hints that you can give people based on your own experience and what's in that document about how to speak more sensitively and in ways that encourage people to work with their doctors as compared to not tell them things or shy away from them.
Well, to start, see people as a human and not as an organ. That's for sure. I don't know where this is something related to your question, but I will still make the comment. We had the nomenclature some years ago, and we changed the name, non-fatty liver disease, into the MASLD, or steatotic liver disease. And I see that even a lot of doctors, but also organizations, still use the old names. And when I say, hey, hello, 3 years, 100 people around the globe decided that we are talking about steatotic liver disease. Why are you still using the old name? And then they say, well, but steatotic is too difficult. Nobody understands what steatotic is. And then I will say, do people know what diabetes means? They don't, but they know what it is. And that's what it's all about. People, it's not necessary. You can say, well, it's steatotic liver disease, and that means that you have too much fat in your liver. That's it. And I'm a little bit disappointed, and I still feel a lot of resistance to use the word steatotic liver disease. But I don't give up. I think it's a matter of time. So that's something that's fair. So I really want to give the audience, just use the name we decided with a 3-year nomenclature. The decision was not taken by just a group of doctors who didn't discuss this with everybody. Patients were involved, everyone, nurses, doctors. So it's really a good discussed subject and use the right names. And yes, it is a difficult name, but then you have a subject to discuss, so you can talk about it.
Jose, you make, I think, a really important and maybe underappreciated point. When we were all going through this issue a couple of years ago, right as the nomenclature change was happening, one of the comments that people made was, well, you got to tell patients they have fat on their liver anyway.
Yeah.
And therefore, why are you changing the name? But I'm intrigued by exactly what you said, because when you tell a patient they've got diabetes, you talk about having too much sugar in their blood or too much sugar in their system in some way, shape, or form. This is the same thing exactly.
Yeah.
The disease has a name, and by the way, fat is the manifestation.
Yeah. And if you talked about that I explained in the queue, back to Amsterdam, I explained that. So it has a difficult name. It's a very difficult name, and it takes some time before you know how to pronounce it. But it means that you have too much fat. But if you talk about, you have a fatty liver, it doesn't feel good. It's a fatty liver. It's, you took too much fat, so it's your own fault. And it's, okay, you took the stuff yourself, definitely, but there are so many reasons and why people are taking the wrong foods, and it's a matter of what we are used to, how the world is and what you can buy in the supermarkets, but please use the right names, and it's a matter of time. I know that, but it's the excuse that the name is too difficult. For me, that's really nonsense.
You and me both. So one other thought I just had listening to you, and I've been doing this for 5 years and I haven't had this thought before, is that to say you have a fatty liver makes it sound like the liver is the problem.
Yeah.
Whereas to say you have fat on your liver,
that's something else. And that's reversible. So if you take some simple steps to change your lifestyle, you will have really it's remarkable results. And we promote hiking a lot. Just go out and you only need shoes and a raincoat here in the Netherlands and in a lot of parts of the world. But and make it also a little bit light. That's my put a little bit humor in it. Mm-hmm. At the association, that's a very funny story. That was a lady phoning me. She said, I know what you're going to tell me. You probably will tell me I have to move more and go outside and walk more, but I hate it. And I said, okay, but then we have a problem. I said, well, I give you something to do. And that is, you go outside, you make 50 steps, put your hand on your liver, on the part of your liver, tell your liver, I hope you are happy because I'm doing this for you. It's very non-holistic. I realized that. Mm-hmm. I said, and then you do, after 3 days, you do 70 steps. And every time you stop, say, hey, I hope you're happy because I'm doing it for you. And of course, she's doing it for herself. And she started to laugh. She said, this is really ridiculous. I said, I know, but please do. A few months later, she phoned me and she said, I have to tell you, I did that. People were looking at me like, what? Where is she talking about? But she visited her doctor after a couple of months. And she said, before I sit down at the desk, the doctor said, what have you done? And she was really shocked about, what's wrong? And she said, but what's wrong? He said, no, look at your numbers. Look at your results of the liver test. What have you done? Because it's so much better. And she said, that motivates me so much. So I really want to thank you for this ridiculous idea. Just count my steps and tell my liver, I hope that you are happy. So it's a little bit humor. It doesn't make sense, no, but it helped her. Well,
it kind of does make sense. Look, we're not all holistic beings, you know. We're people in all our richness and all our complexity.
Yeah.
And when people are afraid, they don't think holistically.
No.
Right, fight or flight. So if you can reduce the fear level with a joke or with humor, then that will make people far more willing to absorb and accept suggestions than they would have been otherwise. And I think that's just great.
Yeah.
I love it.
Yeah.
I love it. Okay. Anything else you'd like to leave our audience with today?
No, thank you for the invitation. And I really recommend to read the article. It's published in
Nature magazine, and we will actually be including a link to it with this interview so people can read it.
Yeah, because the First Liver Charter, it's a fantastic document. I'm proud that I was part of it, but I'm so proud about the people who took the initiative and worked with us together, because that's were quite a lot of people. And really thank you for the invitation again, and it was really a pleasure to talk to you.
Always a pleasure speaking with you, and I hope that even after you find a replacement for the second time in your job in the Dutch Association and you quote unquote retire, that you'll still be working on things. I know you will, and that we'll still be talking. Okay. Thanks, Jose. Have a great weekend. Okay.
You too.
Bye-bye now.
Bye-bye.
On behalf of the surfers, our guests, and our sponsors, Madrigal Pharmaceuticals, Liver Right, and Tawas in Health, thanks for joining us this week.
Please join us again next week when we conclude our roundtable on the Emerging Trends Conference, while our newsmakers and experts explore current issues and major ideas.
And until next week, stay safe, surf on, and we'll see you on the podcast. Bye-bye now.